Okay, guys, hello. It's me. Okay, so looks like we're ready. Looks like we got some people flowing in, or maybe one person flowing in. That's fine. Okay, yeah, so it's working. Alright, so today we're gonna be going over the work that we did for because right, we have 3 days worth of material to learn. So last stream we went over Thursday, September 25th. So that went over chapters 1, 4, and 5 in our Fundamentals of Nursing textbook. And so today we are going to go over Monday, September 29th. And let's see, we can go ahead and open this. And since this was the Kaplan day where we kind of got a rundown, which was half of the class, a rundown of how Kaplan works. So we actually have only two chapters to go over today, so it should be a quicker stream today. And population health is pretty. Like I said in the last stream, some of this stuff is a lot more intuitive. So we should get through this pretty quickly. So we're gonna start with chapter 2. I'm gonna if you guys didn't yet do this, going through the slides is pretty helpful just because it seems to be what Professor Sky just wants us to know. It kind of focuses in on things, kind of like the same thing I did with anatomy and physiology. The slides is more the meat and the bones of what we're going to be learning. So I highly recommend you guys to go look at the slides for September 25th, our first Thursday, where we actually reviewed content. It was pretty helpful to me just to kind of wrap it up at the very end. I'll hopefully I'll get over that. I will cover it this live stream. However, I might not. Last stream yesterday, last night, I was pretty tired, so I didn't get to it. So anyway, so our chapter 2, we're gonna start. I'm just gonna go over. Here's the structure we're gonna do. We're gonna go over the general points of the chapter. So I'm just gonna read along here, kind of get some ideas in. We're gonna go over the key points. I'll probably go over the key points before we start reading the chapter, just so we can kind of figure out what we're supposed to keep an ear out, what is relevant and what is not relevant. Then we're gonna go over the questions at the very end, and I'll give you guys some explanations on how that goes. Why they want us, what's the right answer, and why. And Professor Sky likes to pull questions for the exams from these, so it'll be really helpful. And I also will be using Elsevier as a resource, since Elsevier has a case study that we can use. I'm pulling it up right now. You guys can hopefully see. Yeah, you guys can see my screen. Okay. So yeah, so the Fundamentals of Nursing has case studies for each chapter, and so we'll take a look at that as well. So we'll be going over one for each chapter. So let's go ahead and get started on this. So I'm just let's read the key points here for chapter 2. For chapter two, we're going to go over the healthcare delivery system, and some key points are: an integrated healthcare system consists of network of healthcare organizations that work together to provide and continuum of coordinated healthcare services defined to a defined group of people to improve quality of care, control, and healthcare costs. So this is kind of like let's say a kid comes in with some sort of injury. There's someone that's gonna physical injury. Let's say that they broke a leg really bad. There's gonna be someone, a bone doctor, working with them to make sure that they're all good. There's going to be physical therapists to make sure that they are recuperating their mobility, and yeah, stuff like that. Just basically, that there's lots of different people in the healthcare system that work together, and we're trying to provide a healthcare plan for patients. So it's person by person. Like someone who has cancer is gonna speak to an oncologist. Or gonna speak with nurses. Those are gonna be the people who are helping them hands on, and stuff like that. Also, we have to consider therapists as well, who are also important in the healthcare. Social workers are also part of this healthcare network, who are providing access to things, making sure that they're able to get to their treatments and afford their treatments, stuff like that. So each of the 6 levels of healthcare describes the types and services of different settings in which healthcare is delivered to patients in all stages of health and illness. So we're going to go over that in that chapter. I remember a good bit about that. Each level of care represents the different requirements and opportunities for a nurse. So we kind of talked about this in class. In primary care settings, nurses are extensively involved in patient assessment, whereas in restorative care settings, nurses know that success depends on their effectiveness in early partnering. So stuff like that. Healthcare professionals provide patient care in different settings. For example, primary care focuses on health promotion and tends to be provided in community settings. So yeah, we'll just go over healthcare settings. Americans who live in rural areas are affected by many factors that influence access to healthcare, resulting in healthcare disparities. So we'll go over some common healthcare disparities as well. And these are, again, pretty intuitive, like economic factors, tobacco use, lack of access to the internet, educational shortcomings, lack of recognition of the problem by legislators. So people in the government, are they seeing, the cries for help? And the isolation of living in remote rural areas, you're going to have less access to food. Often happens in some rural, I'll say some, just because I know it's not true in others, but in some rural areas, people don't really have accesses to grocery stores or the choice of grocery stores, choices between them, and so their nutrition is just immediately limited. Discharge planning begins at admission at a healthcare agency. That's actually one of the test questions that I've gotten, I think, on 2 different, like at UWorld or something. I've gotten that before, and it said it starts at the admission. I always write, I remember answering that one incorrectly, but so just immediately once people get in, they're already, setting them up for success, which the way that helped me understand why that would be the case. Barriers to effective discharge planning include ineffective communication, lack of role clarity, and lack of resources. So, pay for value ties to reimbursement qualities. If hospitals perform poorly in quality scores, they receive lower payments. So, also, nurses promote patient satisfaction by providing patient a family-centered care. Nursing shortage has an issue. Person-centered care is focused on patients' preferences, needs, and values. Okay, so that's kind of the gist of what we're going to go over. Those are the key points. So let's go ahead and look at the chapter just for everything that's bolded and make sure we don't miss anything. So traditional levels of healthcare, we're going to start off with these levels. I think these is very important to know, just because it's very quizzable. What are these levels of healthcare? So let's look at this box 2.1 here in the top right of page 15. We got preventative care. So preventative care is like screenings of blood pressure, cholesterol, Pediatric screenings for hearing, vision, autism, and developmental disorders, HIV screenings, wellness visits, immunizations, diet counseling, family planning. So, this is preventative care, preventing the issue before it happens with either, uh, health, stuff like health promotion and stuff, which is actually considered primary care. Primary care, they say, is health promotion, but Professor Sky talked about how preventative care and primary care are so similar. Secondary care or acute care, so things that are severe but last a short amount of time. So that would be like urgent care, acute medical surgery, radiological procedures, and tertiary care. You kind of think of it as levels. Tertiary care is highly specialized, it's extensive care, um, such as like neurology, cardiology, rheumatology, dermatology, oncology. So just very specialized, very specific. And that's what's considered tertiary care. You can think of secondary care as, emergency room visit, emergency care visits, emergency department, I should say. Restorative care is rehabilitation programs, people with either with pulmonary diseases, orthopedic diseases, some bone stuff, cardiovascular stuff, muscular, of course, spinal cord injuries, stuff like that. Home care, people who are have less injuries and more so are just old and kind of want to restore themselves. Continuing care is long-term care, so think of like assisted living, nursing centers, psychiatric, and older adult care. All right, so let's look at the traditional levels of healthcare here on page 15 still. We got 6 levels: preventative, primary, secondary, tertiary, restorative, and continuing healthcare. So we just talked about all of those except primary. And primary is just health promotion stuff. So primary would be like a nurse, a health community nurse going to, let's say, event fairs, community fairs, and just talking about bringing slideshows, talk about diets and ways to promote your health, encouraging sleep, encouraging variety in people's diets, stuff like that. That would be primary care. Or going to the school and offering free flu shots, stuff like that. That would be considered primary care. Primary care, so yeah, so just a quick recap just to get it cemented in our heads. Preventative care, it's a care that's meant to prevent stuff that goes hand in hand with primary care, which is just health promotion. And remember, there's a difference between illness prevention and health promotion. So like illness prevention would be like wearing a helmet, which is preventing injury, while health promotion would be like eating more vegetables, which is sometimes they go hand in hand. Like getting a vaccine would be health promotion and it would be preventative care. But Professor Sky said that the test would never ask you anything that fine and that similar, and that it would be varied. It wouldn't be a dumb question, basically. Secondary care is like the emergency department, stuff that's short term. You come in, for like acute stuff, and tertiary is highly specialized. Restorative is rehab stuff. Continuing care, think assisted living. Things that happen for a long time. So let's go to the next page. So primary healthcare focuses on improved health outcomes for an entire population to promote their regular healthcare visits. So it's kind of what I talked about there. Second and tertiary care. The traditional reason people use healthcare services would be like secondary. The difference between secondary and tertiary care arises from the complexity of patients' medical needs. Secondary health is provided by specialists or agencies on referral by a primary health provider. So primary healthcare providers also are the ones diagnosing. And so So yeah, so primary care you can also think about diagnosing, which I don't know how it kind of that seems to me like it should fit into secondary just because that's like the actual hospital setting, but that's how they define it. It's I wish I could tell you guys where I kind of saw all these questions. I just remember getting asked these questions, but I think they're at the end of this chapter. But we'll go over it. So tertiary healthcare is specialized. So hospitals provide comprehensive secondary and tertiary healthcare. Um, right, which makes sense. Primary care is kind of the health promotion aspect, so you're not going to really see it as in hospitals. Health promotion is meant for you to not end up in the hospital, right? Um, okay. So we can go to the next page. Intensive care. Intensive care is like an ICU, so critical care units, where hospitals or patients receive close monitoring and intensive medical and nursing care. So this is people who are really critically ill and are subject to vitals changing within minutes. So these guys need to have a close eye on them. And mental health facilities. So according um, So, patients who have emotional behavioral problems such as depression, mood disorders, violent behavior, and eating disorders require special counseling and treatment in psychiatric facilities. The psychiatric facilities that exist are in hospitals, independent outpatient clinics, and private health mental hospitals. They offer inpatient and outpatient services depending on the severity of the patient's problem. Patients enter an inpatient mental facility voluntarily or involuntarily. So mental health facilities, they're taking care of health issues, mental health issues. Rural hospitals. So rural hospitals lack have less physicians, obviously, just smaller areas, and they are often the site of a lot of health care. What is that word? Deficits and disparities. Like rural residents are more likely to live below the poverty line. People who live in rural United States rely heavily on SNAP benefits. So that's like EBT. Rural residents have greater transportation difficulties in reaching healthcare providers. Tobacco is a significant problem among rural youth. The majority of rural Americans lack access to high speed internet. Rural communities have uninsured residents and higher rates of unemployment. So, rural hospitals are just, there's just more health disparities there, and it's something that we should be aware of, especially us since we're going to be heading into the um, since we're going to be heading into the healthcare setting. I got someone here in my chat saying, play some games. Ivan's videos. Ivan is my cousin. He's a cool guy. Anyways, we got discharge planning. So discharge planning is going to be something that's pretty critical to the care we're providing. Um, Discharge planning is coordinated and an interprofessional process that develops a plan for continuing care for a patient once they leave a healthcare agency. Um, but studies have shown that patients tend to have a quicker and sicker tend to be discharged quicker and sicker from hospitals just because of the increased uh, capacity issues that we're facing, and there's more discharges occurring during nighttime. So that's for a number of reasons. Uh, why are we? There's just less nurses. We're in a nursing shortage. People are retiring, stuff like that. So, and I want to just loop back on this word that they use, interprofessional process. So that's we're using multiple. Sorry, I got a text. Multiple professionals. Again, like I said, with an example of someone who has a broke a leg. They're gonna have uh, orthopedists working with them. They're gonna have potentially therapists working with them. Let's say they were an athlete and their mobility and their ability to move and their ability to run was very critical to their self identity. There's going to be a physical therapist, interprofessional process. So we're using a lot of different people here. Um, so the ideal discharge planning model, I got box 2.2. We'll just go over this to make sure we cover everything. The goal of the model is to engage patients and facilities with the discharge process to prevent adverse effects and reduce readmission to healthcare agencies. So, of course, if we incorporate people into the discharge process, if we truly communicate them to them, like Professor Sky talks about all the time, people who are told, "Hey, take this medicine. Hey, this medicine makes me feel bad. It's not a habit of mine to take this medicine. I'm just not going to take it. I don't understand its importance." So that discharge planning, part of it is communicative and educating your patient, right? So it's the discharge planning. It's we just want to make sure that people are taking part. Um, the ideal method is to include the patient and family as full partners in the discharge planning model. Discuss with the patient and family 5 key areas to prevent problems at home. Talk about them what their life at home is like. Review medications, highlight warnings and problems, make follow-up appointments, educate, assess, and listen. Okay, so that's kind of what I was mentioning. But yeah, all these things are just important to make sure that people actually adhere to the medications, adhere to the therapy they're supposed to do. The self-monitoring, like people with diabetes get sent home and they're told to monitor their blood sugar, but they're not. They don't. A lot of people don't. Um, and it's in part of the discharge planning's fault. They don't fully understand the importance of it, and so that's a failure not of the patient but of the nurse. Right. Okay. So we just did that. So we're on the next page. Restorative care. Right. So this is going to be rehab. So a patient recovering from acute or chronic illness or disability often require additional services in order to return to their previous level of function or to reach a new level of function limited by their illness or disability. The goals of restorative care are to help individuals regain maximal functional status and to enhance quality of life through the promotion of independence and self-care. Right, so we kind of know what that looks like. Rehab. Let's think of physical therapy. So you see, they got some examples here, like just physical therapy here. Patients in a home. Okay, so home care. So home care is a provision of medically related professionals and paraprofessional services and equipment to patients and families in their homes for health maintenance education. So this is like highly individualized nursing care in people's homes. So what does this look like? Why would this be the case? Some people are willing to pay that extra money to have the care happen in their own home. Sometimes people are, let's say someone is recovering from an illness. Some people still have a certain level of autonomy as they don't really need the full care of a hospital. They can still take care of themselves. So, someone comes in just for a couple days of the week. Um, some people just, yeah, simply prefer the comfort of their own home. So that's kind of what that home care is about. A healthcare setting could be the patient's home. Rehab. So rehabilitation is the process aimed at enabling people with disabilities to reach and maintain their optimal physical, sensory, intellectual, physiological, and social functions. All right. I won't go too much into that. I think we kind of get the gist. This is kind of like the outline that I was just talking about earlier. So we kind of already went into that. So extended care, like extended care is like nursing homes, stuff like that. assisted living, continuing care. Wait, no, extended care is different. It is intermediate care. Let's see what that means. What do you mean by home care admission is often increased due to the increase in PTS being discharged or still acutely ill? Yes, that's very so. So Coral just mentioned how home care is often due to people being discharged quicker and sicker. So that's a pretty good note. So we can tie some information together. Thank you, Coral Lemon, for that. What is intermediate care? Oh, so intermediate care is a level of healthcare that provides more medical assistance than assisted living, but less than skilled nursing care. Okay, so it's kind of easy. An intermediate care or skilled nursing facility often requires skilled care from a licensed nursing staff. Okay, and continuing care, people who are living somewhere for a long time, nursing centers and facilities, right? All right, let's look at some more assisted living. I'm not gonna go into that. We kind of know the gist on that. All right, so respite care. So this one is interesting to me. I actually hadn't heard about this one until class. Respite care is a service that provides short-term relief for primary caregivers, giving them the time to rest, travel, or spend time with others. So let's say if my girlfriend Savannah was very ill and I was her primary caregiver at home here, um, you know, I'm wearing myself out, taking care of her. So someone, I would pay for someone to take care of her while I go on vacation or take a break. So yeah, adult health care centers. So adult daycare centers provide a variety of health social services specific to a patient population who live alone or with families in the community. So Professor Sky talked about adult daycare settings as being like, let's say I am taking care of Savannah here, and I gotta go work my job. Someone's gotta take care of Savannah while I'm doing something. I would drop them off at an adult daycare setting, and then I would pick them up right afterwards. And you can kind of see kind of like the different approaches to care. Um, and a lot of them are based off price and preference. So none of these are like, oh, you go to here, here, here. If this happens, people get a pick. And so adult daycare settings would be typically often people who are less wealthy and still need to work. You know, that's why they'd be dropped off at a daycare. Palliative and hospice care. So palliative care is a holistic, patient, family-centered approach with the goal of improving the quality of life of a patients who are expecting problems related to life-threatening illnesses. Palliative care is delivered by interprofessional teams through a continuum of illness with the focus of optimizing quality of life through early identification and treatment of physical, and spiritual problems, providing relief of pain and suffering, continuing care, and facilitating patient autonomy. Uh, yeah, so hospice and palliative care are often people who are, seeing the end of the road here and are, um, nurses are just there to make sure that they're comfortable during the last days. They're not just in pain and they're, could spend time with their families. Issues in the healthcare Issues in healthcare delivery for nurses. Uh, Healthcare costs and quality. There's rising healthcare costs in America. It makes it harder for everyone. It makes it harder for the nurse because they have to work around the cost, make sure that the patient can afford it. Of course, a big deterrent for people wanting to seek out medical health help is the cost. They can't afford it. There's questions about palliative care. Ask Professor Lehrman. Oh, what? Coral, your mom is Professor Lehrman. Whatever, Coral, man. Just quit plugging your own mom. Healthcare costs and qualities. So it is impossible today to separate two initiatives facing healthcare institutions: managing costs and achieving high quality patient care. So we can read about the affordable. Oh, okay. So here's how some different hospitals get paid. Never mind, I won't go into that. Let's go over the Affordable Care Act. The Affordable Care Act ties payment to organizations offering Medicare Advantage plans to the quality ratings of coverage they offer. If the hospital performs poorly in quality scores, they receive lower payments for services, quality outcomes. So this is where the pay for value thing comes from. So let's say if a hospital is doing really good in their quality, people are really happy, they'll get reimbursed more money. And so that kind of encourages hospitals who were previously paid by the job. They get paid, all right, I injected them with this. All right, give me some money, government. Now they are, instead of just getting paid by the job, they're getting paid for the quality of the work, which is always going to be better. And so that's what the Affordable Care Act is. So whenever you hear pay for value, that's kind of what they're talking about. Nursing shortage. There is a huge deficit. We looked at the numbers. It was like 50,000. Uh, Actually, I don't remember exactly, but there was. We saw the nursing needs, the demand, and we saw how many nurses there actually were, and there was a pretty large deficit. So that's pretty good for us. That means we get paid money. Uh, comp competency. Competencies are an excellent tool for measuring how well nurses practice. Okay. Person centered care. Person centered care is an individualized, compassionate, and coordinated evidence based approach that considers a person's values, preferences when planning care and incorporates them in the decision process. This is very important. Person centered care is much more than simply individualizing patient care. A critical component of person centered care uh, partnering partnering of the nurse, patient, and family caregiver to identify the patient's healthcare needs within the context of the patient's lifestyle, to coordinate the entire healthcare system so that the patient and family are engaged in the process. Basically, incorporate their family, make sure that they're part of the decision making process. Let's look at their values. What do they want? What is important to them? Someone who people can choose to react to diagnosis in different way. People who have late stage cancers, some of them can opt to just live out the rest of their life, let the cancer take its course, and stuff like that. Or someone could opt, no, I want to get the surgery. I want to, even if it's there's a low success chance. I still want it. There's people have different values and people have different ideas. And a good example of that for me, when I'm thinking about how different people's values are, is our do not resuscitate orders. It's like, if I'm going under, just let me go. And I'm like, well, okay. You know, wow. People are really different. So we also got the magnet recognition program. We talked about this in class. It's just a certification people can get, and it's not often that you see it in rural hospitals just because there is no competition. But let's say if you go to the Portland area, some hospital that has a magnet recognition badge will be just seen as better. Nursing sensitive outcomes. So sensitive outcomes are patient outcomes and nurse that are directly related to the nursing care. So, which makes sense, and it would account for a lot of the care that we're getting in the hospital, just because how Professor Sky said, people all stay overnight in hospitals for the care of nurses. You can see a doctor, they diagnose you for 5 minutes, and then they leave, right? They're doing lots of stuff. But it's the care of the nurses that keep people at the hospital. That's why people are at the hospital. So it makes sense that there are nursing sensitive outcomes, that there are outcomes that are specifically dependent on the care that the nurse provides. Okay. So technology and healthcare. So we're getting a lot more technology. So I won't even get into that. Like telehealth, telemedicine, video conferencing with the patient. I did that during COVID. Some new stuff coming out. Diversity, equity, and inclusion. So that's kind of like. Okay, that's good. Everything else is intuitive. Like, yes, diversity is important. Equity is important. Some people don't receive the same healthcare as others just because of socioeconomic factors, stuff like that. Inclusion. Let's try to get the medically underserved community in on this. Let's get them some care. That's pretty intuitive. I'm not going to go over it, or at least it should be. But it's no problem if it's not. All right, so let's go over the review questions at the end here, and then we're going to go over the case studies so we can wrap up chapter 2 in a comprehensive manner. All right. Review questions. Which activities will the nurse perform while participating in primary care? So let's think about it. Primary care. What is primary care? It is health promotion. So providing prenatal teachings on nutrition to a pregnant patient during the first trimester. Sounds correct. Assessing the nutritional status of older adults who come to the community center for lunch. Sounds correct. Working with patients in cardiac rehabilitation program. That doesn't really sound like health promotion. That sounds like tertiary care. That sounds pretty specialized. Providing home wound care to a patient. Sounds maybe not so specialized, but again, that seems like a pretty advanced level of care. Teaching a class of parents at a local elementary school about the importance of immunizations. Sounds correct. Okay, so let's go over our answers. 1, 2, 5. Okay, it looks like we were correct. The cardiac rehabilitation program is just so advanced, we're not going to be doing that. Providing home wound care to a patient, again, that's pretty advanced. We're not going to be doing that. The nurse works in tertiary care setting. Oh, sorry, I'm going to the next question. The nurse works in a tertiary care setting. Which activity does the nurse perform while providing tertiary care? Conducting blood pressure screenings at a local food bank. So tertiary care is going to be highly specialized stuff. So we're not going to be conducting blood pressure screenings at a local food bank. Administering influenza vaccines for older adults at a local senior center. Probably not. Inserting an indwelling catheter for a patient in a medical surgical unit. Probably not. That seems more like acute care stuff. Performing endotracheal suctioning for a patient on a ventilator in a medical ICU. That's pretty specialized. That's what it's going to be. I'm going to go with number 4. Let's see if that's correct. It is correct. Okay, perfect. The nurse provides restorative care to a patient following an extended hospitalization for an acute illness. Which of the following is the most appropriate outcome for the patient's restorative care? Okay. So, nursing provides restorative care for a patient following an extended hospital visit for an acute illness. Which of the following is the most appropriate outcome for restorative care? So, patient will be able to walk 200 feet without shortness of breath. Well, we don't know what their illness is, so we don't know what we're really restoring. So let's see what the answers are here. Wound will heal without signs of an infection. Patients will express concerns related to a return to home. That's probably not it. Patients will identify strategies to improve sleep habits. So it's either going to be 1 or 2. I don't know. I could see it being both. Okay, it's 1. I guess that makes sense. I guess wound healing is a little bit different than. I don't know. I don't know why that would be the case. Why is it 1 over 2? I feel like 2 could also be restorative. A nurse is assigned, maybe because it's specifically about function. That would make sense. Yeah, that makes sense. Restorative is restoring functions, physiological functions. So it would make sense that it'd be 1. All right, so a nurse is assigned to care for an 82-year-old patient who will be transferred from the hospital to a rehab center. The patient and her husband have selected the rehab center closest to their home. The nurse learns that the patient will be discharged in 3 days and decides to make a referral on the day of the discharge. The nurse reviews the recommendations for physical therapy and applies the information to fall prevention strategies in the hospital. Which discharge planning action by the nurse has not been addressed correctly? Patient and family involvement of the referral. Looks like they were involved because the place is close to their house. Timing of the referral, I would say, has not been addressed correctly because you're doing it on the day of them being discharged. It's not very appropriate. Incorporation of referral discipline recommendations to plan care, determinant discharge. Yeah, I'm gonna say 4 is 2. Okay, that's correct. That makes sense. It just hit the ear a little weird that they were gonna wait till the last day to send a referral. So number 5, the nurse recognizes which of the following as common barriers to effective discharge planning. So what is preventing discharge planning? Ineffective communication amongst providers, of course. Lack of role clarity among healthcare providers. I would say yes, that's true. And again, the among healthcare providers is, again, as I mentioned, teams who are working together to make a discharge plan for people. Just because a lot of illnesses are, cover a lot of ground and can affect people's social, can affect bones, can affect physical mobility, maybe a speech therapist for people who are experiencing pulmonary diseases who can't really get the air out, stuff like that. So number 3, number of hospital beds to manage patient volume. I could say that could be one. A patient's long-term disabilities, it's not really a barrier. The discharge planning accounts for the disability. The disability can't really affect it. A patient's cultural background. I could also say that could be barriers to effective discharge planning just because of communication, different values, but it says 1 and 2 are correct. So ineffective communications among providers, lack of clarity among healthcare members. All right, so just commit that to memory, I guess. That question. 1 and 2. It's all a game of definitions anyways. So let's go over, I'm going to go back onto my computer. Let's go over the case study for chapter 2. Chapter 2. How do I not have chapter 2? All right, let me pull up chapter 2. Hold on. My girlfriend's listening to something high pitched. She's probably watching like some brain rot or something, My girlfriend. All right, so let's go over the case studies with the answers here. Open her up. Doctor Who says middle right. I don't know what he means by that. Maybe he was helping me find the file. I couldn't see it. It's funny. There's a bit of delay here, so it takes me a second for me to get to you guys. To get your guys' messages, sorry. All right, so chapter 2. Midge is a nursing student who works as a certified nursing assistant with a local home care and hospice service while she is hospice service while she is in nursing school. She enjoys her work because it presents her with the opportunity. Okay, whatever. Number one, several of Midge patients receive hospice care. Which of the following groups administer a federally funded hospice benefit? Okay, so this one's going to be Medicare. Um, so if you guys don't know, Medicaid is like what for people who can't afford low income insurance, basically. And Medicare is specifically about old people. So people who are above the age of 65, people with with renal diseases, and I forgot the other stuff, but there's Medicare specifically for older people. So when there are cuts to Medicare, the population who suffers is the old people. Okay. So let's go over question 2. Tammy explains the causes of rising healthcare costs to Midge and how the costs impact patient care in both the hospital and home health setting care. Acute care is less costly for patients who wait longer. No, that's false. The more you wait, often the more expensive it'll be because the differences between screening and surgeries, you know what I mean? Um, So Midge learns that nursing care is just one of the service offered in home care settings. Midge learns that nursing care is just one service offered in home care settings. Which of the following are additional services or therapies offered in home care settings? Okay, so home care, occupational, yes. Speech, yes. Respiratory, yes. Surgical, probably not. Nutritional, yes. So that makes sense. They're not offering surgeries at people's homes. Everything else, though, yes. Respiratory, helping people breathe, and oxygen, speech therapies, occupational help, nutritional, of course. While on break, Tammy and Midge discuss the nursing shortage. Which of the following are causes for the nursing shortages? Increased nursing school enrollments, obviously not that. Aging nursing workforce, yes, that. Nursing faculty shortage, yes. Limited nursing school clinical site availability, yes. Limited nursing school available student spaces, yes. Okay, that makes sense. All right, let's go to chapter 5. Oh, it's right here. Oh, man. Oh, wait, no. Chapter 3, sorry. I'll just open up chapter 3 here. Okay. And let's go over the key points for chapter 5. I'll do it this way so you guys can see my cursor. I think that'll make it a lot easier for you guys to follow along with what I'm reading. I realized that was kind of a mistake. So let's go to chapter 3. Okay. So chapter 3 is the population health. So we're going to talk about, populations, people who are medically underserved, people who are, how culture affects things. So let's just get into it. So let's go over the key points first before we start reading the chapter so we can, make sure we don't miss anything important. So the terms community health nursing and public health nursing are used interchangeably. Makes sense. All right. So the population health nurses focus on health promotion, disease prevention, and improving the population's quality of life. In contrast, the community-based Nurses focus on providing direct care to individuals and families with acute and chronic illnesses within the community setting. Oh, okay. So community-based nurses focus on direct care to individualized families. Okay, that's pretty cool. It's a good line to draw. So medically underserved populations are a group of patients who are more likely to develop health problems due to increased health risk, limited care to healthcare, and independent or dependence of others for care. Medically underserved populations may include individuals living in poverty, older adults, people without homes, immigrant populations, individuals in abusive relationships, people with substance abuse, and people with serious mental illness. All right. The population health nurses needs skills in health promotion, disease prevention, and relationship building to fill the role of caregiver, case manager, change agent, patient advocate, collaborator, counselor, educator, and epidemiologist. Nurses play a critical role in community health during the pandemic by identifying cases, preventing illness spread, providing education, direct health care. All right. Community assessment is the systemic collection of data on a population, monitoring the population's health status, and making the information available for the community's health. Okay. So yeah, we're just taking care of the community here, right? All right. So population health. I'm going to be on page 33 here. So community-based healthcare. Regardless for your practice, you need to understand the focus of your community-based healthcare. You got to understand your community, what they need. Who is your community made out of? What are the impacts affecting your community? And of course, community-based healthcare occurs outside traditional healthcare institutions such as hospitals. So this is going to take places in schools, places of worship, senior centers, stuff like that. These settings allow people who are unable to access care in other areas to receive care they need. So it's about getting into the community and promoting health, making sure they don't end up in the hospital. Oh yeah, we're on to this. So population health, we got a definition here on page 34. Covers the health of healthcare delivery continuum, beginning with the public health prevention through the population disease management. Wow, what a word salad. Gosh. Anywho, achieving healthy populations communities. So we got the Healthy People Initiative, which was established by the U.S. Department of Health, which kind of just identifies health indicators and sets goals. So that's where we get Healthy People 2030. So we kind of talked about that in class too, which is pretty cool. Some rural communities do not have healthcare agencies to meet acute care needs for their own citizens. However, the community may have resources to provide childhood. Right. Okay, so yeah. That first bit is just talking about the community. Okay, I'm on page 35 for social determinants of health. So let's talk about them. Social determinants of health are biological, socioeconomic, psychosocial, behavioral or social factors that contribute to a person's current state of health. So Healthy People 2030, again, they are working to identify health indicators. They have their top 5 domains for health determinants are economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, and the social community context. So social determinants. I was listening to a podcast and they talked about how your your zip code might be as important as your genetic code in regards to your health. These are determinants of health. Where you live can have effects again with like the example of grocery stores. Dead zones is what they call them, where there are not when there's no grocery stores around, and those those rural places tend to suffer greatly from malnutrition and obesity just because they're eating foods with Dollar General. Side tangent besides from this, but I think it's important for you to talk about. Um, Dollar Generals, have you ever noticed how they're in small towns, rural towns, and it's the only big store, only big chain store in that small rural town? Let's look at if you guys are going from Newport to Eugene and you guys are going to drive through Junction City. There's that one small town that has that small Dollar General. Yachats has a small Dollar General and one store with groceries. Um, every time I see a Dollar General, it's always at a small area, a small town, and they do this on purpose. They do it so they go to rural areas with no grocery stores and act as a grocery store, and it's pretty interesting. And that kind of increases obesity since people are just relying on nutrition on things that they're sold at Dollar General. They don't have a grocery store; they have Dollar General, so it's kind of interesting. Um, so yeah, so Health disparities are preventable differences in populations ability are preventable differences in populations' ability to achieve optimal health. A disparity exists in health if health outcomes vary by population. Populations can be disadvantaged by the burden of disease, injury, violence, or opportunities to achieve optimal health due to social, political, economic, and environmental resources. Health disparities are multifactorial, including poverty, environmental threats, inadequate access to healthcare, individual and behavioral factors, and educational inequalities. All right, so community health nurses, how do we respond to this? Community health nursing focuses on improving the health care of individuals, families, and groups within their communities. And public health nursing is a specialty where that requires the understanding and the needs of a population. Um, so, what are the trends in your environment? What's going on? Nursing practice and community health. Mostly just health promotion stuff. Community based nursing. All right, impact of global health on community health. Okay, whatever. I don't really care what that says. Medically underserved populations are groups of patients who are more likely to develop health problems because of uh, excess health risk, so limited access of healthcare services, or dependence on others. Examples include people who living in poverty, older adults, disabled people, people without homes, immigrants. Right, immigration population uh, immigrants can face poverty, acculturation, education, housing, and employment barriers. Right, that makes sense. Effects of poverty and not having a home. Again, it's going to be really hard for you to even. I don't have to explain it to you. Patients experiencing abuse. A lot of times, the people who are experiencing abuse are the abuser is the provider as well, which makes it really difficult for them. They don't really have a place to go just because they don't make their own money. They can't really leave. So those are things we have to think about. We have to, if we're going to be in community health nurses, for example, we have to be able to identify those issues. Patients with mental illness, not in the right state of mind, not in good conscience, older adults, retirements, people who don't have a lot of money. Sometimes Medicare is cut. Competency in community health nursing. Just a quick story on the older adults. No. Competency in community health nursing. So we got to be competent in our care. We got to be able to do certain tasks. Like we got to be a caregiver first and foremost. Nurses are caregivers. So that's like actually doing these medical interventions, stuff like that. We got to be case managers. In community-based practice, case management is important. Case managers establish an appropriate plan of care based on assessment of patients and families. So let's say I'm a health manager. I'm a community-based nurse, and I'm in the community, and I see this woman with her children, and they don't have enough money. As a case manager, what I would be doing is, looking at the kids, making sure they have the right nutrition, looking at the mother, making sure that she has resources that are provided to her, making sure that the kids have transportation to go to school. That would be examples of a case manager, which I didn't really think about as part of the nursing practice, but that makes total sense. Change agent. A community health nurse also has to be a change agent that has to, and as a change agent, you have to implement. You have to empower people to take change. You have to be the X factor. You have to be the reason why people start changing. People start, seeking better for themselves. And it's not that they're not seeking better for themselves, but that to give them the tools to change for the better. All right, you have to act as the patient's advocates. You got to stand up for their rights. You got to stand up for their needs sometimes. Sometimes people have troubles. People, like, for example, with mental health in older adults, people have trouble, advocating for themselves. Collaborator, you have to collaborate with other healthcare members for a combined effort for care delivery. Counselor, you have to be an effective counselor. You must be aware of a patient's community resources. You have to help identify and clarify health problems and choose appropriate courses of action to solve these problems. You got to be an educator. I won't talk about that just because we already know. Epidemiologist, we have to nurse epidemiologists are responsible for community surveillance and identifying increased let's say a disease is going around. A nurse epidemiologist, part of your competencies, is things that we should be good at is identifying these diseases and being able to track it around and prevent people from getting it. All right, so community assessment. So what are some factors in community assessment? Once we're looking at our community that we want to help, population would be like, what's the age distribution? What's the sex distribution? What's the growth trends? Where's the density? What is the overall education level? What is the predominant ethnic groups? What is the predominant religious groups? Social systems. What's the educational system like that? How is the schools? How is the local government? How is the communication? Is there Facebook boards where the people are able to communicate, where big services like the government, the local government and hospitals are able to communicate with normal people? What's the welfare look like? What's the volunteering scene like? For structure, what's the geographical boundaries? Are you in a desert? Are you on the coast? How's the water? We're pretty lucky to be in the Pacific Northwest just because of the water. A lot of other people that actually have to know where water pipes are. Places like in the deserts of California. Safety, is my community safe? Transportation, so this can help you outline issues that you might want to address as a community nurse. Changing patients' health. In a community health practice, nurses care for patients from. You need to promote and protect a patient's health within the context of a community using evidence-based practice. For example, nurses can help reduce health disparities surrounding childhood obesity and racial ethnic minority populations through community-based interventions. So yeah, that's an example. Oh, look, we did it. That was it. That makes sense, again, a lot of this is pretty intuitive. So you can just reason that people who are homeless are going to be medically underserved. But it's good to flesh out these ideas. It's good to talk about them just so we can form discussions about it. All right, so let's go to the review questions, and then we'll go into the case study for chapter 3, and then we'll go over the slides really quick, and then we will be done with what appears to be Monday, September 29th. So that will be our second day. We only have 3 days, so tomorrow I'll go over the next, and then on Sunday I'll just give you guys, I probably won't post anything. Maybe I will. Just maybe overview. However, you guys can just study, but what I did this morning was look over the stuff from the first day, specifically the meat and bones, was like the theories and stuff like that. So yeah, just go over everything again. But it's important to do it day by day because, at least in my experience, I don't know about you guys, but the best advice I've gotten from a teacher for study habits is that you have to sleep on it. You have to sleep on it. Okay, I'll be right back, and we're going to do these review questions. I'm just going to grab some more water. Alright, guys. So let's go to question 1 here. The public health nurse is working with the local city and county health department during a pandemic and has created a crisis within the community. So there's pandemic in the community. All right. What are the responsibilities of a public health nurse during the pandemic? Educate the public on disease prevention. Yeah, I would say yes. Serve as a liaison between patients and healthcare services providers. I would say yes. Investigate cases as they arise. I would say yes. Monitor trends of disease outbreak. I would say yes. Assist the testing of identification. I would say yes. And then diagnose patients with disease. Maybe not. Let's see. 1, 2, 3, 4, 5. Wow, I got that all right. It was the first 5 and not the last. Diagnosing is a little different. Remember, nurses do not diagnose. A community health nurse is working in a clinic with a focus on asthma and allergies. What is the primary focus of the community health nurse in a clinical setting? A community health nurse is working in a clinical. Right. So, decrease the incidence of asthma attacks in the community. I would say yes. Increase the patient's ability to self-manage their asthma. I would say especially yes. Treat acute asthma in the hospital. I would say that doesn't really. That's not, again. Community health takes place not in the hospitals as much as it does in the community. Schools and stuff. So I would say no. Provide asthma education programs for teachers, of course, and provide scheduled immunization for people who come to the clinic. Yes, I would say all except 3. Let's see. 1, 2, 2. Yep, okay. Looks like we got them all right. Oh, what? I did. 5 is not listed even though I said it was. I don't know why that seems like a perfect example, but you know. Looks like that's just when we got to commit to memory. And you know, it's pretty hard to do, but if we look over it all, you know, a couple times, and you know, we got Monday after classes study, so we should be able to nail it, guys. Um, the nurse, a nurse caring for a refugee community identifies that children are undervaccinated and the community is unaware of resources. The nurse assesses with the community and determines that there is a health clinic within a 5-mile radius. The nurse meets with the community leaders and explains that the need for immunizations, the location of the clinic, and the process of assessing health care provided. So, which of the following practices is the nurse providing? Raising awareness of the community resources for the children, I would say yes. Teaching the community about health promotion and illness prevention, I would say yes. Promoting autonomy and decision making about, um, maybe not. Improve the healthcare of communities' children, yes. Participating in professional development activities, I'd say maybe not. Yeah. 3 does not include 5, and 3 does not include 3 either. Um, the autonomy piece is like, although it would seem like it's true, promoting autonomy and decision making for healthcare practices, he's not really like explaining, oh, these are some different methods to get a vaccine. He's just telling them, go get this vaccine. Here's some different hospitals. No, he's saying, go to this hospital, right? It's not really so much as autonomy. So number 4, what factors result in medically underserved populations being more likely to develop health problems? Ability to use the ability to use available resources to find housing. Who wrote that? That's so terrible. The adequate transportation to the grocery store and community clinics. I would say 4. 4 would be the biggest medically underserved because that means just because it's almost a definition, you know, limited access to healthcare services. 5. The nurse is a new community-based clinic is requested to complete a community assessment. Which of the following steps in the correct order for completing this assessment? Ooh, I think it's structure, population, and then social systems. Yes. Oh, okay. That's correct. I remember structure being first just because let's see, because I saw like a video about it and it was talking about how like before you begin zooming in on the town, look at where the town is. So you know, geography, structure, then population, and then the intricacies between them. So it kind of makes sense if you're looking at like a top view of a city. Look at the city as a whole first, look at the people, and then look at the connection between the people. Right, that makes sense. All right, so let's go over. Looks like we're done with the book for today. We can just put it away. We're going to go with Chapter 3, Case Studies with Answers. All right. Mrs. Reese is considering a vulnerable patient. Vulnerable populations are groups of patients who are more likely to develop health populations as a result of excess health risk, who are limited in access and who depend on others for care. Um, yeah, I kind of read over that one a little too quickly, but it's because I knew what to say. All right. When interviewing Mrs. Ruiz, is it okay to have Mr. Ruiz present as long as he understands that he may not be abusive? Oh, right. So this was the case study with Mr. Ruiz is abusive. So uh, let's just read over this. Um, Miss Anita Ruiz is 23. Nah, we're not gonna read that. Basically, Mr. Ruiz is abusive, so he cannot be there because he's just gonna influence what they're gonna say, what she's gonna say. Mr. Ruiz has tuberculosis. Because of this, like other community nurses, Michelle will also serve as the role as of Epidemiologist? Yes. So Michelle could also serve as the role of educator in an effort to promote health teaching about tuberculosis, but since it's so specific to the disease, it would be epidemiologist. So yeah, community nurses apply principles of epidemiology by being involved in the case findings and health teachings and tracking incident rates of illness. Mr. Reese tells Michelle that she has left. She left home at age 14 and was homeless until she met Roberto, or Mr. Ruiz, who found her a job and provided shelter. When Mr. Ruiz was a homeless teenager, she was at an increased risk for which of the following? I'd say risky behaviors. Yeah, because of the immaturity, they're going to be risky. And I think of like substance abuse right now, and we're learning. I guess next week we're going to be learning about how teenagers are exploring and just do risky stuff. Oh, okay, that was it. All right, cool. So, guys, looks like we made it to the end. We just have to look at the slides. And the slides are always very easy, of course. 43 slides, so let's just get through it and then we'll be set for the day. And that would be a comprehensive review of Monday, September 29th. So that would be, we have now covered 2 days of uh of information. So all right. Sorry, just a quick phone break here. Oh my gosh, I opened the wrong thing. Okay. Here we are. 4 challenges facing nursing, aging baby boomer generation. So people are getting older, more people need care. Shortage and uneven distribution of physicians, where there is a huge deficit. Rates of nursing retirements. Nurses are also getting older. Uncertainty in healthcare reform. Things are changing. Medicare is being cut. Medicaid also funds rural hospitals. Will many rural hospitals shut down from the big beautiful bill? Who knows? Who knows what's going on? The success rate of this stuff is not too high, so hopefully, some stuff gets switched around. So yeah, baby boomers, people are getting old. Um, let's look at California for nurse. There is a demand of, the difference here is 50,000 people. When you turn 26 and can't afford healthcare insurance, guess I'll die. Right. Prospect payment. Affordable Care Act, reducing costs, improving quality. Right. We don't, overall healthcare ranking, we are the lowest, but we pay the most. See, that's a huge problem. Traditional levels, the 6 levels we already went over: preventative, screenings, primary health promotion, secondary, acute care at a hospital, tertiary, specialized, restorative, uh, re- restoring someone's physical capabilities, continuing care, assisted living. All right, cool. Primary care, improved health outcomes. Secondary care, hospitals, mental health facilities, rural hospitals. Restorative, home care, rehab. Continuing care. Yeah, continuing care. Oh man, continuing. Oh yeah, daycare, respite, quick quiz. Patient who needs nursing and rehabilitation will probably get restorative. Oh, it doesn't even tell you. Continuing care hospice, people who are about to pass away. Healthcare costs, patient satisfaction. So this is the paper value thing, the patient satisfaction. Competency, patient-centered care, we know this. Magna recognition, we know this. Um, Community-based nursing, get out there. All these, this is kind of just review, so I'm just kind of looking at it pretty quick in case that there's anything we're missing. Yeah, so this is everything we talked about, which is good. That means that the things I highlighted and kind of went over more in depth were the stuff that we were supposed to. All right, looks like that's it for today, guys. Good job, team. The only thing I would say is to, um, what was I gonna say? Oh yeah, make sure to go over the week 2 theory exam. Go over it. Use it as a study thing. Just because I know she's gonna pull some questions out of there. We got 44 questions. I'm sure one of them's gonna show up. So just review those, guys. I'm sure that's a couple easy, quick questions. But anyways, thank you guys for listening in. I hope that I could have helped in some way. And if you guys need any questions, of course, you guys can always text me on GroupMe. So thank you guys.